Hey, it's Dave Brown here, host of Now with Dave Brown on AMI. Check out this latest highlight from the show.
Now, the Canadian Council of the Blind and Fighting Blindness Canada are hosting a call to action through a new petition to develop a national vision health plan. The petition comes together from their recent report, The Cost of Vision Loss and Blindness in Canada. Here to tell us more about it is Doug Earle, the president and CEO of the FBC. Doug, thank you for being here. Appreciate it.
Thank you for having me.
Now, back in October, Dr. Keith Gordon was on our show and talked about the CCB and FB's recent report. Can you just remind us briefly what the report sort of put out as findings?
Sure. So working with the Canadian Council of the Blind, Fighting Blindness Canada, the Canadian Association of Optometrists, and the Canadian Ophthalmological Society. So really, it was a group effort. We found that there were 8 million Canadians living with a blinding eye disease that puts them at significant risk of losing their sight. Already 1.2 million have uncorrectable vision loss that we just don't have research solutions to restore or prevent further blindness for them. And that the economic impact, the social economic impact was $32.9 billion. And then just in October, we did release an update as to the impact of COVID had between March and December 2020. And almost 1,500 Canadians, unfortunately, experienced vision loss because of 143,000 cancellations of eye surgeries. Almost 3 million people didn't go to an optometry visit. This is just devastating to know because we know that if you're diagnosed early, we can stop and in some cases even restore vision loss with what research has delivered for 3 out of 4 Canadians.
I have to say, in my family, there were procedures that were delayed because of COVID-19 and the impact that COVID was having on the healthcare system. But what was surprising to me and what continues to be surprising to me is that something as crucial and important as your vision would have had to be delayed, that there weren't more efforts to find ways to make sure that those types of procedures could go on, right? Like I've gone through the whole thing with a bad shoulder injury. I can make that. I can make it through. But when it comes to vision, I was surprised that there weren't more efforts.
Well, this is why the Canadian Council of the Blind, Fighting Blindness Canada, our optometrists, ophthalmologists, opticians, Diabetes Canada, we've put together this coalition of vision partners that are advocating on behalf of the community, and we need the community to step up for a national vision health plan. Our report on COVID, there was in Canada. We also had discovered that there was one also in the UK, and I think it speaks to what happens when in the UK they have a national vision health plan. The anti-VEGF eye injections were declared an emergency treatment. Their population is double the size of Canada in the UK, yet they had almost 15,000 fewer anti-VEGF injections, whereas in Canada we had almost 74,000 fewer eye injections, and that's a part of the reason why almost 1,500 Canadians experience vision loss. We didn't have this national health plan. The federal government has stated on the world stage to Canadians and to the world that we would have a national vision health plan. They've done it 4 times since 2003. And most recently in a unanimous General Assembly motion in July 2021. But we're still waiting. And the results of that is that Canadians are not being able to access treatment. We had a very different regional, depending where you lived, impact of COVID on and how the health system responded, and also just encouraging people to get that preventative step of a regular eye exam so that you can get diagnosed early and let research-delivered treatments save your sight for 3 out of 4 Canadians.
Now, There are a couple of recommendations in the report that are sort of the backbone of your petition. What are those recommendations?
Well, first off, we need this national health plan. We need all the stakeholders together to draft it in order to address the impact of vision loss, and it's preventable vision loss. Secondly, many of the large diseases like vision loss, when you have 8 million, 1 in 5 Canadians living with a blinding eye disease, they have a vision desk in Health Canada, which coordinates the federal response across the country, working with the provincial governments. We don't have that. That's one of our prime calls. The developing through the Public Health Agency of a national vision health prevention strategy. How are we going to get the 40% of Canadians living with diabetes that don't go for a regular eye exam, even in a 2-year period, and even though it is covered by your provincial health system? That is a critical step, and we need to have a national strategy. We need to be working together in order to develop these programs so that we can prevent vision loss.
So beyond, the pressure of a petition, what do you think it's going to take to get the attention and to get action? I mean, you've said it yourself 4 times now. This has been, quote unquote, made a priority by the federal government with no real follow through here. We certainly have heard, at least I know in Ontario, where the provincial government has sort of pulled back Ontario OHIP coverage of certain eye care for a segment of the population. What is it going to take to make eye health care and rehabilitation a true priority and get true action?
Well, Mike, it's so true. All we have to look at is this first sight restoring treatment that has been developed for blinding eye disease, an inherited retinal disease called LCA, Leber's congenital amaurosis. Health Canada approved Luxturna, the brand, the drug's name, in October 2020. 4 weeks later, fast, very short timeline, CADTH and INESS recommended it for public funding. And then it went to the provincial governments, and we have been waiting. People like Adam, people like Jack, people like Romney, people like Sarah or Nora, they've lost 3 million photoreceptors needlessly because the system is not responding. That's why we created this approveluxturna.ca website to send an email to your premier and your health minister to say, fund it now. This is the first gene therapy. It is the first that will set the stage for all the other therapies that we're watching go through clinical trials right now. We need the community to stand up. We need the community to sign our petition at StopVisionLoss.ca. Without us having a collective voice, we will not be heard. It'll be like that tree in the woods falling and no one noticing. So we need everyone to stand up. We need you to go to websites like approveluxturna.ca to send your email to your premier and health minister requesting this access to treatment. We need you to stand up and go to visionloss.ca, sign the petition for a national health plan, because that is how people pay attention, and it is critical.
And where can we send our audience to access the full report?
So if you go to StopVisionLoss.ca or the website that's being displayed here, FightingBlindness.ca, stop-vision-loss, then you can get a copy of the full report. You can sign our petition and add your voice to the growing number of Canadians that are saying enough is enough. We've waited long enough. We need a national vision health plan.
Doug, really appreciate you being here, and kudos to you and all your partners for being the lead voice on this. Truly important.
Well, thank
you.
Thank you.
That was Doug Earle, the president and CEO of Fighting Blindness Canada. You can follow the campaign on social media. The hashtag is StopVisionLoss, or you can sign that petition by going to FightingBlindness.ca/stop-vision-loss.
Do you want to dive into more conversations like this? Watch Now with Dave Brown weekdays at 9 a.m. Eastern on AMI TV, or download the podcasts wherever you listen.